The Philippine Medical Association and Philippine National Police expressed strong opposition to a bill seeking to legalize the use of marijuana for medical purposes. Grace Casin will tell us why.
This is Sachi, 8 years old and has epilepsy. He suffers seizure attacks that last for 30 minutes to 1 hour. Sachi's father Romeo says Sachi's medicine is no longer effective to lessen his seizures. As a father, it hurts him to see his son suffer from pain. This is why he is supporting the calls to legalize the use of cannabis sativa or marijuana in medical purposes, hoping that this will help cure his son's illness.
10 to 15% lang ang reduction ng anti-epileptic drug. So, can you imagine if a person is having a 300 plus seizure, right? So, 10% of the 300 lang mababawas. The anti-epileptic drugs is slowing down their growth as well.
University of the Philippines Manila Pharmacology and Toxicology Professor Dr. Romeo Quijano says that based on their research, cannabis sativa or marijuana has a component to reduce the pain and seizure of a patient. Dr. Quijano adds that even other countries use this to treat cancer patients.
Nakakalma niya ang ating mga brain para masuppress. The raw marijuana contains flavonoids. Flavonoids are well known to be anti-cancer.
But the Philippine Medical Association expresses strong opposition to this. PMA President Dr. Minerva Kalimag says that there is no strong study that this is safe for the patients, especially on its effect to the body of the patients.
It can cause euphoria. It has effects on parts of the brain that actually controls coordination of movement and then memory and learning. So we don't really know what will be the effect of long-term use.
Dr. Kalimag adds that the Food and Drug Administration has a current administrative order allowing the use of several percentage of cannabis sativa if the patient really needs it. PMA fears that if marijuana will be legalized, some might use this as a vice.
There are certain portions of the bill where it states that they can allow cultivation and cultivation of the plant for research purposes. And we know that we have very poor monitoring mechanisms here in the country.
But on the supporter of the House Bill 447, Ang-Nar's party list representative Leah Pakis says there are safeguards in the bill to prevent the abuse of the drug.
Authority muna po now will handle everything. So there is an authority. There will be a compassionate center na magbibigay po nito at magkakaroon po ng facilities naman, 3, na siya naman po ang gagawa ng mga research para dito.
Meanwhile, PNP AIDSOT is also against the legalization of marijuana. In a statement, AIDSOT says that the Philippines is one of the signatories in United Nations Convention in Narcotics and Psychotropic Substances declaring marijuana as illegal. It adds that some of the provisions of the proposed bill need further studies to assure that substance abuse will not happen. Grace Casin reporting for Y News.